Jeanette's on here.
Good afternoon, everyone. If you're just joining us, we're going to get started in 1 minute. We're just continuing to let folks in the room.
There's waters or sodas allá.
Gretchen Baljeed, do you think we should get started or do you want me to hold off a minute or so? Go ahead and get started. Okay. All right. Well, welcome everyone. Thank you all so much for being here today. My name is Laura Krizwicki. I'm a program director at CFPIC, and we wanted to welcome all of you to our first CalAIM Brown Bag session in 2025. So thank you all so much for being here today. CFPIC, in partnership with CWDA and their support, will be hosting monthly brown bag sessions beginning this month in January. The topics will vary each month, and later today in the presentation, we'll be hoping to hear from all of you around maybe there's some certain topics that you would like to hear from us or you would like to have TA around. So if you haven't muted yourself, if you can go ahead and do that too. Thank you so much. So again, we'll be hosting these each month and hoping to hear from you around some topics that might be most helpful for all of you. Today's brown bag, though, will focus on the path-cited funding for round 4, and you will hear some overview around that. You will hear some application tips, and then the really cool thing is we have some county folks here that are going to be on a panel, and so they're going to share their experience from receiving cited funds earlier in the round and kind of share some lessons learned, be able to answer some questions that you have, and provide some tips for you as well. So that's going to happen later on in the training today. Today's training session will be facilitated by Baljeet Hundal and Gretchen Schroeder, two of the very best CalAIM experts that we have here on our team. Baljeet has a 30-year career in health and human services, working in both private and public sectors. She's implemented several key initiatives and reforms and was recently the lead for CalAIM implementation in Mariposa County. And we have Gretchen, who is a community health strategist with experience in public health policy and has 20 years experience working with community-based organizations, counties, and healthcare providers. So with that, I will go ahead and kick it over to you, Gretchen.
Great. Thank you, Laura. Hi, everybody. Hope you're doing well. Hope you have some lunch. We do have a very robust agenda. We do want to save time, hopefully the last part of the session today for our county panel. However, if you have questions, please put them in the chat. Please raise your hand, come off mute. We want this to be a conversation and really want to make sure we get all of your questions answered. So fun fact, the state made a lot of changes this week with path-cited. So we have thrown a lot of information to the slide deck. We did a lot of links in there. So as we touch on things, you're like, oh, I'd like to go learn some more. We do have the links to the state resources that can really help address most of your questions. But big news is that path-cited is really going to now extend a little bit longer. We're going to have our applications due May 2nd. Instead of March 7th. So we have a few extra months to get these applications done. We're still waiting for guidance as to what else that's going to impact, but that was announced earlier this week. So with that, I'm going to jump into our overview of path-cited round 4. So the state has put out a couple of different funding streams to really help ECM and community supports providers and organizations who want to become providers really set up their programs. So to build that capacity, to create the infrastructure that's needed to really serve these serve folks in these programs, as well as to expand our services. On the left-hand side, we have what's called the IPP program, the Incentive Payment Program. These are funds that the state gave to the Medi-Cal managed care plans for them to give out to providers or to build infrastructure themselves as they saw fit. Most of those dollars have been spent, but we do encourage you to talk to your managed care plans, see if they have any left. Some do and are doing some targeted investments with these. But on the right-hand side, we have our PATH initiative, which has been designed to really address capacity building, infrastructure building in a couple of different ways. Of course, what we're talking about today is the PATH CITED grant funding that we'll go through, but they also have some different collaboratives that the state's funding to help folks get to know each other and build the network needed for these programs. To support the justice-involved providers as we launch pre-release services across California. And then, of course, the technical assistance marketplace, which is where the state actually pays consultants to help you all on ECM and community supports. But let's jump into CITED here. So as part of CITED, the state has hired a third-party administrator, or TPA, and the TPA is the Pacific Consulting Group, and they are the ones who we interact with when we're trying to do our CITED application. They do the presentations, they'll be answering questions, all that good stuff. So just be aware that we're not dealing directly with the state here on PATH CITED. We also want to make sure you're aware of the community supports updates that are happening. In late December, the federal government did approve California's waiver, which allows for transitional rent. That will become the 15th community support. And I'll talk a little bit later about when that will be implemented, how it interacts with PATH CITED, what we know about transitional rent. We're going to hope to get some more guidance from the state in the coming months. So just be aware that big change has happened. So a lot of hopefully excitement about a transitional rent is out there. So let's go into PATH CITED. So these are grant funds the state gives directly to providers to really build capacity, expand capacity, build that infrastructure that folks need to really do ECM and community supports. And there's a couple of different ways to think about PATH CITED funds. One is for organizations that have not yet contracted to be an ECM or community supports provider. And we want to target you guys. So if you are looking for that money to do that initial investment and getting up and running, PATH CITED is for you. We're also looking at folks that are current PATH CITED, current ECM or community supports providers. And that you're already contracted. And so PATH CITED is also for you. It's a way for you to invest more in your infrastructure. It's also a way for you to expand your services. So maybe you're only serving 50 people through your community support service and you really want to serve 100, but you need some more dollars to really make that possible. So that's where PATH CITED can come in. Maybe you're an ECM provider who's only serving a couple populations of focus and want to expand that. That can also be part of what PATH CITED supports for you today. But the key thing is you either need to be already contracted for ECM or community supports or in the process or intending to contract. So those are the two eligibility requirements that are really important for you all to know about. PATH CITED dollars can be used for a wide array of things. It can include hiring new staff. So if you need to hire a billing specialist, for example, you can use PATH CITED dollars to do that. It can also be used for training and recruitment of staff to, again, do ECM and community supports. It can help you purchase a vehicle, again, in service of ECM and community supports, purchase electronic health records, all these types of things it can be used for, and many, many more. But it really is a great source of funding for that ECM community supports, either implementation or expansion. Yes, Frieza.
Hi, can you repeat what those two qualifiers were? I joined a little late.
Sure, no problem. So one is that you're already contracted for ECM or community support service, or you're either in the process of or intend to contract for ECM or community supports. And if you're not yet contracted, but you still want to apply for PATH CITED, you need to get a letter of attestation from the managed care plan you want to contract with. So just be aware of that. And of course, our managed care plan partners would like to have your request for that letter of attestation come in as soon as possible. So just reach out to your managed care plan and work with them on that. This is the last round of past cited funding. It's going to be a very competitive round. So we'll talk about some tips and tricks of how to make your application stand out. But this really is important that if you are thinking about doing ECM or community sports, you're already doing it, want to expand, this is the last round of funding that's going to be significant as far as we know for ECM and community supports. And again, if you just joined, the big announcement this week from the state is that they are extending the deadline for the application. It is now going to be May 2nd. So we do have some additional time to work on the application, which I think is great. So a big change for this round of past cited versus previous rounds is that this is going to be a 1-year funding cycle. Previous rounds have been 2-year. So the state is emphasizing that if you're going to be applying for round 4, you need to do what they call shovel ready. So you're ready to go day 1 when you get the dollars. We don't want to spend time trying to get, I don't know, ideas of what we're going to do. We want to have all of it laid out. We wanted the plans ready to go day 1. So that's going to be really important to think about. The other piece is there is no limit to the amount of funding that you can request to past cited, which is great. But the state has been making folks aware that in the previous rounds of funding, the average award was $1.1 million for a 2-year funding cycle. Again, no limitation. There have been some very large awards in LA County, for example, and some very small awards, but just be aware that the average is about 1.1 million from previous rounds. The state has put out their funding priorities for round 4. And again, since this will be so competitive, it will be very important that you make sure your application fits into some of these priorities. The 2 top bullets are going to be around what are the gaps and needs in your community, in your county, across the state for ECM and community supports. We'll talk a little bit later about how to identify what those gaps and needs are. The state has put out their priorities, which is going to be around the birth equity population of focus for ECM, around the justice involved, and of course around transitional rent. And we'll share some recent updates from that in a few minutes. Other priorities are tribal entities or entities serving tribal members, rural counties. And again, if you are rural, I encourage you to really emphasize that in your application. A lot of the application reviewers are not based in California and may not know which counties are rural or which counties have rural parts to them. So I think incorporating that into your narrative in your application will be very important. An interesting piece here is they do want to fund organizations in counties that had not received a lot of prior cited funds. And I have a big map I'll show you in a bit that will tell you where most of the cited dollars have gone across the state in prior rounds. So again, doesn't mean you shouldn't apply if you're in LA County, which got the most, but it does mean that if you have been in a county, or if you are in a county that has not been funded, you get a little bit of priority bonus points there. If you are serving individuals whose primary language is not English, another priority for the state in this round, they really want to fund local community-based organizations. Initially, as a lot of you may know, organizations were getting cited funds, getting contracts who may be serving multiple counties. So the state's trying to drill down now and really fund local organizations. And then flash here, counties that are going to do transitional rent, they really want to help you start to build out the infrastructure to do transitional rent. So keep that in mind as you think about past cited for your county. I'm just going to, again, this is a big overview. There's lots of information here, but want to give you some key things to think about as you look at past cited for your county or for your organizations that you're partnering with. Some of the evaluation criteria the state has put out here is going to be really important to think about as you design your application and write your narrative and create your budget. We want to make sure that, of course, all the applications align with those state priorities. So go back to that list, figure out where you fit in, and make that a priority to talk about. We also want to make sure that in your application, you really identify what is the need that your cited application is going to address. What gap is it going to address? So if you don't have providers in your county serving that birth equity population of focus, make sure you identify that gap and how you're going to address it, for example. We want to make sure that the budget in your application aligns with the narrative in the application. That's a huge issue that we found in prior rounds. Folks don't have those two things lining up. And the state has another webinar coming up, I believe, next week, looking at the budget section of the application. So I encourage you all to apply for that. And we have the link at the end of the slide deck here for that. And then a really important thing to think about in your application is how do you sustain things after the cited funds have been spent? So if you're going to hire staff with these cited dollars, what is your plan to sustain that staff member after the cited funds have been spent? That could be by increased ECM revenue. It could be through, jumping into ECM for the first time and really getting those dollars flowing. So just think about that and make sure you have a really clear, concise way to sustain these efforts ongoing. Additional criteria, and we have a lovely map that I'll come to next, but they want to make sure that we're distributing these funds in an equitable way geographically. So we'll cover what that looks like in a minute. They also want to make sure that you are collaborating with your managed care plan partners, with other providers in your county, with your collaborative, your PATH collaborative folks, and that your application aligns with those needs and gaps identified in those efforts. So if you have not yet joined your PATH collaborative for your county, I encourage you to do so as part of preparation for your PATH cited application. And we do have a link in here about how to join. And then we want to ensure that whatever we're going to ask for cited dollars for, that's really going to expand people's access to ECM and community supports. That's really important to the state. As you all know, enrollment has been lower than desired. So we want to figure out ways to really increase enrollment, increase utilization across the state. So here is our fun map. Hard to see, I know, a little bit, but the dark counties are the ones that have received the most funding. So that dark blue one is LA County. They've received the most dollars, and you can see the lighter shaded counties are the ones with the least amount of funding. So just be aware that if you fall into those lighter counties, you are going to be a priority for the state to fund. Doesn't mean if you're in LA, you shouldn't apply, but just the priority points will be going to folks who have not yet received a lot of dollars in their county. Any questions on what I've just covered? I know it's been a really high-level overview, but a lot of resources here that you can access to dig in deeper if you want to. All right, no questions. I'm just going to keep going. So in addition to the regular PATH cited, they also have what's called a PATH cited IGT, and that's only available to public entities like counties, like public hospitals and cities. And as you all probably are aware of the IGT process, it's a way for the state not to put in as much money. And so what this means is as you go through your PATH cited application and you're a public entity, you can opt into being considered for the PATH cited IGT. So they'll first review your application for the regular cited. If you're not awarded dollars through that, then they will consider you for the cited IGT process. So a bunch of information here. I don't want to spend too much time on it, but do be aware there's going to be two opportunities here for applications if you're a public entity. So once you've been awarded, you'll be required to submit quarterly progress reports. And I've heard a lot of folks say that these are really onerous. I've heard some counties say these are a piece of cake. So it does require some work, but I think a lot of this can be addressed as you set up the milestones in your budget in your application, is choosing milestones that make it easy to report on. And again, we're going to have some counties share with us how they've done this, and maybe they can answer some of the questions around that. And funds will be dispersed for completed milestones. So let's say that you want to hire staff members. If once you've been awarded, if you want to go ahead and hire that staff member before the progress report period starts, you can go ahead and do that, but you won't receive dollars until that reporting period has taken place. Any questions here? So the tentative timelines for the quarterly progress reports, and this may change given that our deadline has been pushed out. They may also distribute funds a little bit later. But right now, what we're seeing is that the first reporting period will be for October 1st through December 31st of this year. So again, we'll let you know if things change. This is what we're working off of right now. So some application tips here. We're going to jump into that. I do have some examples the state has put out towards the bottom of the presentation. But I probably won't get a chance to cover those today, but do know they're in there. You can review them at your leisure. But a couple things come up that I think are really important here. One is that you really need to make sure that your application is addressing an identified gap in need. And that can be what the state's identified. It can also be what's been identified by your managed care plan. It can also be what's identified in your PATH collaborative. And so one of the things that the state has listed, and they have a guidance document with all of these links in them, is that we have these gap filling plans and managed care plans wrote back at the beginning of ECM and community support. So not incredibly recent, but they do have those. So you can go back to those and cite that as a way to see what the identified needs are in your county. If you have a local homeless plan, that can also be a good reference document for what are gaps and needs. And as we think about transitional rent, that's a great resource. And then again, the PATH collaborative planning groups that meet every month, they're talking about PATH CITED, they're talking about gaps and needs. And so just, you can join that and see what's being talked about there so you can align your application with what's happening in the county. Of course, as we're talking about Medi-Cal dollars, it's really important that we make sure our PATH CITED application does not duplicate or supplant any existing services, especially those funded by Medi-Cal. So just be aware of that. We're really trying to expand ECM and community supports. We're really trying to increase the number of people who can access it. So keep that as kind of a focus point for your application. Some really nitty-gritty details here, but I want to point this out because I think a lot of folks have missed this in prior rounds. One of the important pieces here, especially if you're already contracted, is you want to identify the ECM populations of focus or the community support services you need CITED funding to do. So if you want to start serving a new population of focus in ECM, you should identify that in your CITED application and make sure you either have an executed contract for that population of focus or get a letter of attestation for that population of focus. So just be aware that they're really drilling down here and want to make sure they know exactly who you plan to serve with these CITED dollars and that you have a contract to do that. We also need to know the number of current and additional ECM members you plan to serve. So if your focal point for CITED is to really expand the numbers your agency or county serves, we need to have the numbers you currently serve and what your projections are going to be. So we're really trying to figure out how do we best increase access for folks, increase utilization and enrollment. So be aware of that. And we don't want to have the application talk about all of the populations of focus you're currently contracted for and serving, but only what you plan to use the CITED funds for. So really keep that application narrow to what you'll use the CITED dollars to do, not everything else that you're doing. Any questions on this? Quiet group here today. All right, we will keep going into my favorite new topic, transitional rent. The state just unleashed a bunch of information at Monday's CITED meeting. We're still trying to understand what this means. You guys may have some additional information. I'm hoping the state did some education with counties as well, but who knows? So let's just jump into it. Again, high-level overview. We don't have a ton of details yet on transitional rent. We expect to get more guidance in February and then again in April. So we'll keep our eyes open for that. But transitional rent is the 15th community support service. It will allow the managed care plans to provide up to 6 months worth of rent for qualifying individuals. And this is really intended to line up with the Prop 1 dollars that we passed back last fall. So the intent here is if we have an individual who qualifies for transitional rent, the intent is that housing deposits will help cover that first month's worth of rent. Transitional rent will cover months 2 through 7. And then the Prop 1 housing dollars will start to pay for housing and rent services beginning in month 8. So that's the goal. We hope it can be realized. So the qualifying criteria for transitional rent is going to be 3 things. One, you have to have a clinical risk factor. And here's what we know those factors will be today. These may change. You have to be either experiencing homelessness or at risk of homelessness per the HUD definitions. And you also must be a member of a transitioning population. So you're transitioning out of unsheltered homelessness. You're transitioning out of a carceral setting. So here are the criteria they've listed so far. Again, we hope to get more details in the coming months. So we have to have folks meet all 3 of these buckets. Just to make our lives more complicated, the state has rolled out populations of focus for transitional rent that don't line up with the ECM populations of focus. So just be aware we have to be specific about ECM or transitional rent populations of focus. So they have 8 listed here. And of course, I think the state is wanting to target that population of focus number 1, behavioral health, for the reason I just mentioned, so we can leverage the Prop 1 housing dollars. What we do know about timing for transitional rent is that it will be optional for managed care plans to offer July 1st. I think there'll be a couple of managed care plans who will go forth and do this, which will be exciting. But I think the majority of managed care plans will be planning to launch this when it becomes mandatory on January 1st of next year. And they will have to start with that behavioral health population of focus. Questions on this so far? All right, so who can be transitional rent providers? Who can do pass cited for transitional rent? So they've listed out a couple of folks they would like to see apply for pass cited for transitional rent, but it's certainly not limited to the county behavioral health departments, CBOs, public housing authorities, or continuums of care. But they're really trying to get those folks to get involved in transitional rent through pass cited. Providers who do want to do transitional rent and apply for pass cited dollars to do so really need to have alignment with the goals of transitional rent. They really need to have an organization that can really manage and administer multiple pots of money coming in, have strong collaboration with managed care plan partners, and a commitment to data sharing. That's going to be critical for a lot of the transitional rent pieces. And we do have some guidance around the state's idea of flex pools, what that looks like. And I think the overarching goal is that we're going to have organizations or flex pools that have multiple housing funding involved in it. And we're trying to use that funding to best meet the needs of individuals who qualify. So think about it that way. One of the big things around transitional rent is that we do want to make sure that that MCPs are working in partnership with these organizations, with these counties. And if you do want to apply for transitional rent for pass cited, you do need to have a letter of support from the county behavioral health department. So again, the state's really trying to drive these partnerships through pass cited. So here's a nice infographic about the roles and responsibilities for transitional rent, and counties, again, you can play a really vital role here. Maybe, start talking about it, see, what the county's thinking about, but it's going to be really important to get involved in this, I think, early on. So if you're thinking about pass cited, look at transitional rent as well. I'm going to pause. Questions, thoughts? Everybody's still eating, I hope. All right. Again, if you think of some questions, please drop it in the chat, raise your hand. But now I'm going to turn over to Baljeet for our county panel.
Thank you. Baljeet Handel here. So we do have 3 county representatives to walk us through what the cited process has been for them, as they have been awarded in prior rounds. And so we have, and then we have a couple of questions to guide the conversation. And so what I'm going to ask is our county folks from Mariposa, Santa Cruz, and Tulare, as I turn to you for the first question, introduce yourself and your role there at the county as you answer the first question. So I'm going to start with the first question. Share your experience with the cited application from prior rounds in which your county was awarded. And I'm going to turn to Mandy from Mariposa first.
Hi there. Good afternoon, everybody. Thank you so much for having me. My name is Mandy Brum. I'm a division director here at Mariposa Health and Human Services Agency. And so from what I've been able to gather, we have been able to really support our system of care approach, which unifies both internal efforts across our department and with our community partners to especially serve with this funding, the justice involved population. So really to support their efforts as they transitioned out of incarceration to ensure that they had Medi-Cal benefits and were receiving the supports necessary to really help support that transition back into the community. And so to support them with that seamless process and also being very intentional in partnering in that effort.
Great. Thank you, Mandy. And I'm going to turn to Shannon with Tulare.
Hi, everybody. Shannon Tolbert with Tulare County Health and Human Services Agency. I'm our Deputy Director over our Integrated Services Division. And so we went for rounds 2 and 3 of CITED. And we used both of those rounds to build out our enhanced care management program. So we actually did contract to do enhanced care management. And so we really did use that to build out our capacity for our enhanced care management program. And so we built out our, we do 5 different populations of focus. So we do homeless, the SMI, SUD for both adults and children, justice involved for both adults and children, foster care, and CCS. So we've used both of those rounds to build out each of those. And then we used also to work with our stakeholders, our community stakeholders, for all of those programs. Homeless probably being one, homeless and SMI SUD probably being the largest of the populations that we work with. That's probably the majority of what we're serving right now. The other ones are a lot smaller, but that is what we used our dollars to help build our capacity for.
Great. Thank you, Shannon. And then George with Santa Cruz County.
Good afternoon, everyone. My name is George Malakowski. I'm the division director for our planning and evaluation team for human services. And I'm also going to post in the chat kind of the breakdown of all 3 rounds of money we got through PATH. The first round, we used about $250,000 to really assess the county infrastructure as well with some of our community partners for data sharing related to a lot of the different programs that would serve the priority populations. And then the round 2 money, which is more justice involved focus, was really around how do we implement systems to get the pre-release folks enrolled in Medi-Cal. And then the round 3 is for procuring an actual data sharing system. And I will note that unlike the previous 2 counties, we are not a super agency. We have a separate health and human services department. So we work in collaboration with them, and they administer, in particular, the round 3 monies, which you can kind of see in the notes. And then I'm also joined by a couple of folks who've been part of the process, Viridiana and then Lynn, who may chime in as we go through these questions.
Great, thank you. And I'm going to go to the second question, but if anyone has questions for the panelists, just raise your hand and I'll make sure that you get to ask your question as we go along. So I'm going to go to the second question, and George, I'm going to stick with you on this one. How did you determine the gaps and needs your cited application would address?
Yeah, so I think there were a few things. One, as a county, we realized that there was really a gap in terms of the data sharing work that had been done between departments, between health, human, probation, sheriffs, and kind of within the county departments that would facilitate the work of CalAIM the past CITED project. And so we really kind of focused on that first round of like, how do we prepare for what we know is coming, which is building bridges within our data systems and within departments. And so that was really the focus, kind of both in round one and round two, about how do we bring the partners to the table, have resources to do so, and be thinking about the different systems that we would need to leverage to make this actionable.
Great, thank you. And same question to Shannon.
So first and foremost, we looked internally at our little division. Our enhanced care management program was building out a new division within our agency. So again, we're a super agency, but our division is newly implemented within our super agency because we sit within our admin branch, and we do care coordination across all branches. So with it being newly created, that means we don't have a lot of resources within our own little branch. So we were having to look for gaps within our own little division first. But we also work very closely with our PATH collaborative. So we worked with them to see what was gaps within our community, as well as we work very closely with our local homeless task force, which works on our local homeless plan. So we work with them as well. So between those three efforts, that's what we were using to identify what gaps we could use this CITED funding for, to be able to implement within our team.
Great, thank you. And then Mandy.
Yeah, absolutely. So being a small and rural county, we are small but mighty, and we're fortunate to have a lot of fantastic community resources and community partners. And even across the community and across teams internally, what we found that was that sometimes there was a gap in communication. And so by also utilizing these funds to help support the implementation of a community information exchange, we've been able to help with a closed loop referral system that really does improve both that communication and also client outcomes. And so there's a lot more advance notice if, let's say, a client is being, released from incarceration and needs supportive services or a care team to help make that transition run a little more smoothly. We've been able to use the funds there as well to go back and kind of look at the way we were collaborating across systems and across teams.
Great, thank you. And then Shannon, I'm going to turn to you for the third question here. Share your experience with the management of the CITED funds, from reporting requirements, working with the third-party administrator, PCG, and how you spent the funds and any lessons learned thus far.
So I will say our experience has been very good. We've had a very good working relationship with the TPA, with DHCS. They've been very responsive whenever my team has had questions. Our milestones, if we've had to adjust them, they've been very easy to adjust. I would say our biggest challenge has always been around our internal time frames. So like when we've had to try to meet a milestone, like let's say staffing, right? When we had to hire new staffing, our internal timelines can sometimes be lengthy. So to try to meet a milestone that we have set for ourselves for the funding sometimes can't be met because of our internal timelines and it exceeding the milestone. So sometimes that can be a little bit of a challenge. But again, the TPA is willing to work with us and adjust our milestones so we can push it out. It just means that we can't meet that milestone as quickly to draw down those funds. But again, that's not a them issue, that's an internal working policy issue. So that's the only challenge we have experienced, is just trying to meet the milestones due to our own internal county, timelines, and trying to expedite those and working against those. So overall, it's been a very, probably one of the easier experiences working with grants and things like that, because the portal is very intuitive, easy to use. Whenever we do have an issue, the TPA has been very responsive to quickly resolve any issues. And again, milestones for us, for the most part, have been very easy to meet, except where sometimes we've had to adjust the milestone and push it out a little bit because of our own internal time frames that we can't meet necessarily when we want to.
Thank you. George, turn it to you for this question.
Thank you, Baljeet. Yeah, so I think, similar to Shannon, it's been relatively, I would say, straightforward. And I'll also invite Viridiana, who's done most of the direct reporting, to chime in. But before she does, I think, as we said, we've designed a lot of the milestones so that they can be met and we can get reimbursed in a way that has been relatively easy. And when we have had changes or additional milestones, the state has been relatively responsive. Even, sometimes there's a little bit of delay in getting back, but that's been fairly easy. And I'll turn it over to Viridiana for her thoughts.
Oh, yes. It has been a positive experience. I have found it easy to do most of the progress reports. I think it was in progress report number 7. They made some updates that were helpful. I believe we tried to make a milestone update, and I had come just to kind of back up. I came in the middle of this, so I didn't start the original reporting. So we needed to do a new milestone, and in progress report 6, I believe I had believed I had done it based on some instructions, but it didn't actually work out. And then I believe they made some updates on 7, the progress report 7, that made it a lot easier. And I felt it was a lot more intuitive, and I really appreciated that. But it's been really easy to work with them. I feel like they're encouraging us, and they want us to be able to find a reason to utilize these funds. So I find their support, it's been great.
Thank you. And Mandy?
Well, again, yeah, I would echo the other panelists here, and that it's just the importance of setting milestones. And sometimes we can be ambitious with some of that, and it all looks great on paper. And then when you pull in, the human element and different community dynamics, to include community emergencies or, staffing shortages, it can be a little bit challenging. But overall, things have gone fairly smoothly. And I know, our community partners and other county departments have been really glad to be on board, especially with our CIE. So, yeah.
Great.
Sometimes.
Great. And so I think each of you have kind of already answered this question, so I'll just open it up. But question was, have you had to make any adjustments to your milestones? And I know, Shannon, you spoke to that. George and your staff spoke to that. Anything else that anyone would like to add to that question?
Yeah, I'll just kind of add to what Viridiana talked about. We found that one of our milestones didn't take as much money of the grant as we anticipated, and so the state allowed us to add another milestone to try to fully expend the grant amount. And so, as Viridiana said, that was relatively straightforward. It did take a bit of time to get the approval, but we were happy that the state agreed that we could use the funds to meet the additional milestone.
Great. All right, last question, and then I'll open it up. But are there any changes you would make to your CITED process? And we'll go back to Mandy to start for that one.
I don't know that there are any changes. What I would say, though, is that it's something so right now we're currently not an ACM provider. And so I think that if in the future that's a potential for our county, we'd be in kind of a different position to look at, future opportunities in a different way. I think, I feel really fortunate. I know the CIE has been tremendous here in our county, here in our community, and it's really strengthened partnerships. And ultimately, we're all moving in the same direction when we think about client outcomes. And it's really enabled us to do that in a meaningful way. So just really grateful to have the opportunity. And yeah, it's exciting to see what's possible and what some of those next steps may be, but no change I can think of for now. Just, yeah, thank you.
Thank you. Shannon?
Yeah, I was trying to think of anything, and same, I can't think of any changes that we would make either. The changes we would make would be stuff like, it's not necessarily of what our CITED process would be. It'd be like, man, I really wish we could expedite that process, but that's an internal process, not a CITED process necessarily.
Right, thank you. And George?
Yeah, thanks. I think, similarly, in terms of our planning, kind of where we thought we would be with some of this, I don't know that I would make a lot of changes. I think kind of one of the biggest things as we think about rolling this out that maybe we'd have a different focus is how do we make the connection between the Medi-Cal members and the healthcare plans and actually the referral to ECMs and creating more of a closed loop referral system because it feels like it's a wild, wild west with ECM providers, quite frankly, and it's not very coordinated and it's not organized, and only 3% of our county, Medi-Cal members are actually enrolled in ECMs. And so, like thinking from a systematic perspective, how do we improve that? And I think statewide it's about the same, right? So people aren't getting these services. And so how do we really improve that and make those connections ongoing from our perspective, especially with um, the folks that are been identified as focuses, and I'm thinking particularly from a human service perspective, I'm thinking about children and families involved in foster care, older independent adults. Like there are clients that could really use these services that there's not a good way of making a connection or making a referral to our managed healthcare plan and then figuring out what actually happens with them. And so I think thinking about how this money could be spent in the future, maybe that's something that we could explore as a county. But I'll also, if Lynn or Viridiana, you have other thoughts, I'd appreciate you chiming in as well.
As for me, I think you covered them pretty well, George. So thank you. I'm not sure if Lynn has anything she'd like to add.
I can't think of anything right now.
Great, thank you. So any questions for the panelist from participants? Do you feel like you're in a position to really start exploring the cited application and seeing it as maybe beneficial to meeting the needs of your community, right? Especially the populations of focus that are part of Calais.
I have a question for Mandy. So I think one of the things we hear from the state is you need to either be a contracted ECM or CS provider or intending to contract, but it sounds like you guys weren't. So I'd love to hear about that exception the state made and how you approach that process in your application.
Yeah, so that is correct, and that we aren't. And I have to be honest with you, I'm so sorry. I don't have a lot of information on that. I would definitely invite Baljeet to add some value there if you're able to weigh in and help answer that question. And then I'd also be happy to commit to following up and bringing that back to the group because I think it is something where it's kind of unique. So, Baljeet, did you have anything you could add there?
No, so I think the county applied for those funds after I left, I believe. But yeah, I think in the earlier rounds there were probably a lot more flexibility. And now they're getting more and more strict with it or more and more narrow. But I think what we've presented here today is 3 different counties utilizing cited funding based on the needs of that particular county and your community. And so, again, really looking at if this is a potential funding source that you're interested in, really starting to think about what is the need there, what are some of the gaps, having those conversations with your managed care plans, having conversations with your county partners so that you're all on this together. And maybe it's, a United County application with multiple partners, and maybe one entity is going to be the lead on it, but you're fulfilling a need countywide and not just for one department. So I think the extension and the deadline is going to help having some of these conversations and having some of this thought into planning this. So you have a couple of extra months to really kind of think this through. All right. I don't see any hands up, any questions. There is one in the chat. Are they using Unitas for closed loop referrals? We do know that Kaiser is really pushing the Unitas platform for closed loop referrals. We have provided some guidance to counties on that. per the MOU. The state has not come out with one platform that they want the closed loop referrals. And so if you're a county with multiple plans, I would suggest really kind of getting an understanding from each of the plans what the goal is with closed loop referrals. But there is no direction right now for county programs to be on the closed loop referral unless you're an ECM or community supports provider. Gretchen?
Sorry, so many questions. I wanted to jump into Lynn, one of the things you put in the chat about the TA Marketplace, and I was curious if you could speak more about how you leveraged TA Marketplace and CITED and didn't duplicate.
Oh, sure. Let me think. So we've actually had several TA Marketplace projects, and it was the timing. We wrote the cited application and included some consultant funds, and then before we even knew that we had been approved for the cited, we actually applied also directly to the TA Marketplace. And the TA Marketplace, there's lots of different types of resources. So workforce development, doing assessments, things around data. And for people who aren't familiar with it, the thing that's nice is you don't pay the vendor. You apply for a project, it gets approved, then you select it. Once you've selected a vendor, they write the scope of work, they write the budget, and the state pays them directly. So we did a project, again, sort of assessing readiness across county divisions to do ECM or divisions to do ECM or community supports. We looked at some of our the data sharing and data platforms that are currently in use and their ability to integrate into ECM and community supports. We had a separate project that was really just focused on our current ECM team to do workforce development, training, help us develop our workflows and policies and procedures. So those are just some examples. I can answer questions if there are any.
No, that's great to look at how you can leverage both resources. That's great.
So I'm going to turn it back to you, Gretchen, to close out the webinar. I think we have a couple of more slides left.
Sure. Let me see if I can share my screen again without, of course, going crazy. Yes, here we go. So just a couple things to wrap up this session, and thank you to all of the county panelists. I think your experience is really valuable and helpful, and having other folks think about where they're going to be applying. We do have a bunch of resources in the slide deck. Again, as Len just talked about, the TA Marketplace, we do encourage you all to look at what you can access through that resource. And then you can use your cited funds to supplement or go in a different direction with that. So check that out. We do have links here for the different cited round 4 documents. We encourage you all to look at these, especially the guidance document. It's, 45 pages, but it does have a lot of really important information, including all of the gaps and needs the managed care plans had submitted to the state back in 2022. So check that out. It's a great way to start thinking about gaps and needs. And of course, your managed care plans can let you know what the current gaps and needs are. And they have a bunch of sample budgets that are on the website to help you think about how to develop yours in a way that makes yours stand out. So check those out. The state also has had some webinars, the Making Your Application Stronger, which was last week, part 1, and then they have part 2 coming up next week. They had a lot of really good examples in that slide deck about how to make your application strong. So I encourage you all to look at that. Here's one idea or one example. If you have received additional funding, you have to explain to the state why or how you're not going to duplicate the funding. So there are some examples around that. They also have some really good examples around project descriptions and goals, how to write that. So it's a really strong application. And then, of course, as we all think about sustainability, they have some examples in that webinar as well. So I encourage you all to check those out. We also have some pretty standard ECM and community supports resources to use as reference documents. So hopefully that can be helpful as well. And then, of course, if you need more assistance or have any additional questions, please feel free to reach out to us and we will do the research and get back to you. And Laura, I don't know if you want to add anything here.
Yeah, I think Peter was gonna provide
Okay.
it. Yeah.
Great, thank you.
All right, hi everyone. Thanks for attending our Cowie and Brown Bag. Please take a moment to fill out a survey. The survey link is in the chat. I also dropped the flyer for our next Brown Bag. The topic will be home safe. And if you have any questions, please feel free to contact Laura. Her contact information is also in the flyer as well.
Great, thank you all so much.
Thank you,
Appreciate it.
everyone.
Thank
Have a
you.
good rest of your day.
Great afternoon.